Ashley, and I'm the program director for both the general and vascular sonography programs. And I'm going to talk to you a little bit about kind of what a sonographer does and a little bit about our program itself. So just a little bit about ultrasound, just so you kind of know how it works and what you'll be doing. The sound waves, we use sound waves to emit into the patient's body through a transducer, and the sound will reach various internal structures and they reflect and scatter differently. And through those returning echoes, we're able to actually visualize within the patient's body to help make diagnoses. So we use sounds above 20,000 hertz. These are what's considered ultrasonic, and audible sounds have frequencies ranging from 20 to 20,000. So you can see how high our sound waves are in order for us to see within the body. This is some ultrasound equipment that we typically use. The machine on the right, we actually have in our lab at Owens, and we also have, that's a Philips machine. We also have some GE machines. And then the one on the left is kind of where technology is heading with some of these handheld, smaller type of probes, used a lot for emergency cases or things like that. Okay, so just a little bit about the profession. These are, this is our scope of practice. So some of the things that we are responsible for within our job, we maintain patient privacy. We maintain a safe environment for the patient and other healthcare professionals. We have to correlate a patient history to our exam findings and what we're seeing on the screen. We communicate with our patients. We communicate with radiologists and other members within the healthcare facilities. We have to follow protocols in order to go through our scans to make sure that we're not missing everything and get every image. We also perform basic patient care tasks. We analyze the sonographic images and provide data to the supervising physician. We work in partnership with other healthcare professionals, not only radiographers and MRI technologists within our own little departments, but nurses and physicians as well. And we are also responsible for obtaining CMEs and taking opportunities for professional growth. This is a job that you're always going to be learning and growing within. Some different education requirements. There are a lot of different options, but the easiest way is to graduate from an accredited program, which we are. A graduate is then eligible to sit for their boards through the ARDMS, which is typically our credentialing body. Other options may include on-the-job training or cross-training from one specialty to another, but this would require 12 months of on-the-job experience in order to sit for the board. So graduating from an accredited program, you're immediately eligible to sit at that time. Associate degree programs are available, which is what we are, as well as bachelor degree programs. Other colleges and universities do offer that option as well. Job outlook, employment of diagnostic medical sonographers is projected to grow 23% through 2026, which is much faster than the average for other occupations. And employment of cardiovascular technologists is, or vascular, is projected to grow 10% through 2026, which is still faster than the average for all occupations. So this is a growing field, and our students don't typically have, issues getting jobs or anything, which is a good thing. Employment for general, there are approximately 66,000 employed sonographers in the US, and over 50% of all general technologists work in a hospital setting, so that's going to be our main route of employment. Others are employed through physician offices, independent facilities, outpatient centers, things like that. Most general sonographers full-time work a 40-hour week, and approximately, oops, I can't read this one. And approximately half of these are on call during evening and or weekend hours. So that is one of the things about our job is we typically do have on-call requirements. We do have emergent cases, so we are required to be staffed 24/7 in a general sonography job. In a hospital, sometimes with a clinic or a physician's office, you don't always have those on-call requirements. And they rotate. It's not like you would be on call every day, every night, and weekend and holiday, but we rotate that through the technologists on staff. Vascular, there are approximately 20,000 vascular sonographers in the US. About 2/3 of these work in a hospital setting, so the majority of them do work in a hospital. Other than that, they can be employed in clinics, mobile services, physician offices, and independent labs. Most vascular sonographers work a 5-day, 40-hour week, and approximately half of these are on call during limited evening or weekend hours. I would say vascular sonographers tend to have a little bit less call than general sonography and are not always staffed 24/7. It does depend on the facility, but you do see a little bit more flexibility in vascular with not having maybe as much call. Sonographers can work full-time or part-time. Per diem options are also available to fill in as needed. A lot of our students in the area start off in these per diem roles where they're working, filling in for vacations or time off, medical leaves, things like that. It's a great way for you to get your foot in the door and kind of find that place that you really like and want to work. Like I said, sonographers are needed around the clock, so we do take call, we do work holidays, we do work weekends. If you're lucky enough to land a job in a physician's office that only works 9 to 5, then that's a different story, but like it said, a lot of the jobs are in a hospital setting where sonographers do have type of requirements. Salary, so the Department of Labor indicates median wages for sonographers, and this was in 2016, is about $30.90 hourly or $64,000 annually. So again, this is median wage. This is probably not what you're going to come out of school making, but after so many years in the field, this is kind of that average. The mean average wage for a sonographer in Ohio is $30.12 or $62,000 annually. So pretty comparable to the national average. Obviously, like I said, this depends on years of experience, location, and clinical setting. Call is not always the ideal option, but you make a lot of money doing call as well. So a lot of new grads tend to take a lot of call to make some extra money. Advancement opportunities, so with their educational background and experience, ultrasound technologists have the opportunity to transition into other medical imaging specialties or into direct patient care jobs with additional education and training. So some sonographers will choose to go more of an administrative route and take on a managerial or supervisory role within the hospital or physician's office that they work at. Others may share their experience with aspiring ultrasound technologists by becoming educators, like all of us. There's also research opportunities that are available. Some sonographers go on to be in machine sales, so they will work for GE or Philips and go out and train other sonographers on equipment. There's lots of different advancement opportunities within our field. So a day in the life of a general sonographer, I just kind of wanted to go through some of the typical things that sonographers would scan. Everyone tends to think that it's just babies and that's all we do all day. And while that's a fun part of what we do, it's not honestly the majority of what we do. So a general sonographer, they're kind of lumped into the catch-all. They kind of do everything that is not super specific for vascular or for cardiac, which would be echo. Kind of everything else falls into a general sonographer's job. So they scan the abdomen, different organs. Typically we're scanning soft tissue organs. We're not good at looking at bone or things like that. So like the liver, gallbladder, pancreas, the aorta and the IVC, the spleen, the kidneys, and we can look at the abdominal wall. We also do pelvic exams, so we can look at the uterus and the ovaries, the appendix, bladder, things like that. We also can look at superficial structures, so we scan thyroid, breast, scrotum, popliteal artery behind the knee. We also do musculoskeletal, which is what MSK stands for, so we can look at tendons and muscles and joints and things like that. And we're also that catch-all for any lumps and bumps. If you were to go to your doctor and they felt a lump on your arm or your leg or wherever it may be, they're going to send you for an ultrasound to get the characteristics of it to see what it might be. And then, like I said, the one that most people are super familiar with is obstetrics. So we can view all trimesters of pregnancy starting at approximately 5 weeks of gestation all the way through delivery. I just want to go through some student qualities as well for what might make a good sonography student, and just a little bit about our program in that aspect. Students are enrolled in the sonography programs, or who are enrolled in the sonography programs, must have strong study skills. We are a fast-paced program, as is any medical imaging program, probably any School of Nursing and Health Professions program. You have to retain and apply a lot of information. It's not just memorized for a test, which a lot of classes before you could go would do. But now this is all information that you have to know and remember in order to do your job. So students should be organized, motivated, and a self-starter. Time management, so reading and studying outside of classroom hours will definitely be necessary to be successful. We do require 6 hours of open labs outside of normal classroom hours, so I always like to put this in there just so students know that there are additional requirements, because a lot of your scanning assignments, most of us probably don't have an ultrasound machine at home, so this is why you have to come to lab to work on your assignments in the classroom setting. Holding a job during the program is possible, but many students find it difficult. I always like to throw that out there too. It would be difficult to work full-time during this program. A lot of students during their first year are able to work additional hours, but once you get into a second year of the program, it's basically 40 hours a week. It's 32 hours a week of clinic plus classes on top of that. So some students find it hard to, work a lot of hours during the program. And these are just some qualities of a successful sonographer. Emotional stability, you're going to be dealing with, patients who are sick, or, everyone thinks that OB ultrasound is just fun and games, but I mean, sometimes you put the probe down and the baby doesn't have a heartbeat. So there's things like that we just have to be very emotionally stable. Maturity. Good judgment, empathy, good spelling and writing skills, good physical and mental endurance. Sometimes we do 12-hour shifts and then we're on call that night and we get called back in. So, but then usually you get the next day off. So it's good, but you have to have that physical and mental endurance. Good hand-eye coordination is a lot of times something that we notice. Students that are really good with sports sometimes, or video games, are often very good at sonography. So just something I like to throw out there. Students should have attention to detail, good communication skills, a team mentality, management skills, and should be well organized. And I just want to throw some program statistics out here for both of our general and vascular sonography programs. So these are our graduation rates for the past 3 years. So you can see that vascular has, pretty good graduation rates, mostly 100%. We've got an 80%. We did have a little lull there in 2018 with our general program, but we have seen these stats going back up. So program completion, I feel like our numbers are pretty good in that. Most of the time, if students choose to leave the program, it's on their own accord. It just wasn't the right fit for them for whatever reason. Credentialing rates, I'm always pretty impressed by these. Our students do a great job at their registry exams and passing. We include those in our course and lab fees, so students typically take them right away, right after graduation or even before graduation. So we have really, really good credentialing rates. And then job placement rates, it speaks for itself, 100% across the board. Our students are getting jobs, our students are needed in the field. I want to say that this is not always a full-time job. Like I said before, a lot of students start in like a per diem role and are working to kind of get their feet in the door. But a lot of them do go on to be full-time or at least part-time within a year or two. So. And then this is just a little funny thing that I like to add. And I also realized that cutting vascular out of my presentation, and it wasn't much, but I just want to touch on that, a day in the life of a vascular sonographer, if that was something that you were interested in, that's very specific to the arteries and veins of the body. So we visualize upper and lower extremities, carotid arteries in the neck, the aorta and IVC. It's just very, very specific to blood vessels and blood flow and things like that. So like I said, general sonography is kind of that catch-all. Vascular sonography is very specific. And then there is like a third modality for cardiac, which I mentioned, or echocardiography. We do not have that program currently at Owens, but that is another subspecialty of sonography.